Yeah, so I'd like to explain to you an injection therapy that is very useful for very many different pain scenarios, and that's prolotherapy. Prolotherapy has its roots in rejuvenating tendons and ligaments and joints. And that's the beauty of it, is that it's just not a painkiller. Painkillers, if you stop using them, they lose their effectiveness because they're not going to cure the problem. The problem at the bottom of a lot of ailments such as arthritis or things like fibromyalgia or tendinopathies, whether it be a rotator cuff tear, whether it be a knee problem, is that the cartilage or the tendon or the ligaments have broken down and they haven't become integral anymore. The basic analogy that I use is of a big rope, and that rope has had some fraying to it. That fraying affects the nervous system and it sends pain signals. What prolotherapy can do is it can rejuvenate and fix up those tendons, those ligaments, those joints that are so painful, because it helps to repair the process. And that goes through I usually use from between 4 to 8 to 10 treatments. And the injections are the use of dextrose. Now what dextrose does is it stimulates a healing reaction. So it stimulates just a little bit of inflammation. The body is supposed to fix things up. It's supposed to repair. With a chronic injury and chronic inflammation, it hasn't repaired. So things are going on there that shouldn't go on. Your body should get over the bump and it should be fixed. And what happens is you feel pain at the beginning for a reason. If you smash your thumb with a hammer, it throbs, and it's throbbing for a reason. Your body doesn't want to go on forever with a broken thumb. It wants to fix that up. The inflammation, the acute inflammation, is a good thing. Everybody needs acute inflammation to fix. What happens is the body moves platelets and white blood cells, and growth factor is released in order to heal up whatever broken part we've got, whether we fall on our knee or we hit our thumb with a hammer. It's all in the gear of getting fixed up, and the body wants to do that. With chronic inflammation, it gets over that bump of a month to 2 of the acute inflammation, and then it doesn't know what to do. It keeps the inflammation up, hoping that the body will respond, but it's not. What the injection does of the dextrose, as far as prolotherapy goes, is that it stimulates the repair again, and it gets that kick started so that the body's own platelets and own white blood cells will come in, repair the joint or repair the tendon or the ligament, whether it's a rotator cuff injury, whether it's a cartilage injury, whether it's a meniscal injury to the knee, whether it's a tendinopathy, whether it's a ligament problem, which is often what happens in the low back. These can all be addressed and used, and prolotherapy used to help to fix eventually, which is the delight of most patients, is that they don't have to come back repeatedly for treatments. We get to a place where they're happy and the pain level is much reduced, and that's a very, very, very common event with the use of prolotherapy.